Hello, class. This week, chapter review is on chapter 3, and it talks about the sources and the different bodily effects that a drug has on it. We have 5 sources. Our primary source is going to be plant, but the 5 sources in all is going to be plants, animals. We have minerals. We also have synthetic and genetically engineered, same as DNA, okay? So plants is going to be our primary source. So this is going to be where most of our drugs originate from is a plant. So it can be anything as it relates to berries, bark, leaves, things of that nature. And it's going to, an example of it would be like our poppy plants. That's going to be a great example. And it'll be a drug like a morphine or a codeine that's going to generate from our plants. And then we have our minerals. Our minerals are from the earth. Minerals are things as it relates to iron, sulfur, potassium. All those things are going to fall under the category of our minerals. And it's going to be a magnesium. So a magnesium will actually come from a mineral. And then we have an animal. Our animal is going to really talk. It's really going to be the thyroid gland. So the thyroid USP is going to be coming from an animal. And then we have synthetic. Synthetic is when we got a little bit more educated and we kind of got into the lab a little bit more. So our synthetic drugs are going to be a combination of laboratories and advanced understanding of chemistry. Okay, so a drug source is synthetically put together, and it's going to be because of a more advanced understanding of chemistry and then our labs. Okay, so an example of that would be our thimerol. And then, of course, we have DNA, our genetically engineered medicine as well. And it's going to be an example such as hepatitis B vaccine, okay? And then we have an effects of a drug. We have 2 different effects. We have even a systematic effect or a local effect. A systematic effect is going to reach a wide spread of the area of the body, okay? So say, for instance, an ibuprofen. An ibuprofen is like a tree for arthritis. So if it hurts your knee, okay, we can take it for our knee and it's going to do what it needs to do for us treating it. But we can also take it for our head, we can take it for our cramps, we can take it for sunburns, all of those different things. It treats all of those things. Versus a local effect. A local effect is only going to treat exactly what it needs to treat, one particular thing, okay? So, for instance, like I said, it's limited to the body and it's only going to treat where it's administered to go and what it's supposed to treat. So, like our hemorrhoid medicine, if we put it up our rectal, it's going to treat only that. It won't do anything for your head if you're having a headache. It's going to do only that. So that's the difference between our local effect and our systematic effect. Systematic is going to control anything. Anything. It could be an ibuprofen that can work for your head. It can work for your knee. It can work for your back. So it can be a widespread versus our local effect. Our local effect is just going to be one part is limited to the body and it's only where it's administered. So we talked about our rectal. So if you have a hemorrhoid pain and that medicine is going in your rectal, it's only going to control that one part and that's it. So we also have what's called drug processing by the body. It's 4 different steps for drug processing by the body. And it's also known as pharmacokinetics. Okay, so make sure you remember that word, but it's 4 different steps, 4 stages, okay? The first step is going to be absorption. Absorption is when the drug actually enters the body and goes to your bloodstream. So this can be whether it's oral, whether you're taking it by mouth, or you're taking it through your IV, and no matter how it takes, the drug is going to hit your bloodstream, and that's absorption. It's how it gets in the body, okay? And then we have distribution. Distribution is when it comes from your bloodstream and it moves through your tissues and your different fluids of the body. So it's going to whatever part of the body needs to be treated. So we have absorption, the way it's coming in through your mouth, whether it's coming in through your IV, but it hits the bloodstream. And then you have, like I said, you have your distribution. So your distribution is once it comes in, it goes out. Comes in, goes out. So it's going to go into your tissues. It's going to go into the fluids of your body and does what it's supposed to do. It's going to go ahead and treat what it is that it needs to be treated. And then you have metabolism. Metabolism is the 3rd step. The 3rd step is metabolism. Remember that. So metabolism is going to actually be the breaking down of the drug in your body. So we're going to break it down. And then excretion. Excretion is how it comes out. So whether it comes out through your sweat, whether it comes out through urine, it's all in the same step of excretion. So like I said, 4 steps, and that's the drug processing for a drug, okay? Or pharmaceutics. So absorption, when it comes in through your mouth, through your IV, however it comes in, whether it comes in through your rectal, however it comes in, it's going to go to your bloodstream. And then secondly, distribution. When it comes in through your mouth, it's going to go to whatever parts it needs to go, whether it's your bodily fluids, your tissue, and it's going to treat whatever area needs to be treated. And then we have our metabolism. Our metabolism is breaking down of the drug. And then excretion is how it comes out, okay? So a lot of times with excretion, if you have to do a drug analysis or something like that, and you have that urine, a drug, should we say, that'll come out in your urine and it still shows up, that's why, because it has to release itself. A lot of times your urine is still going to be very dark when you see that drug still in your system. You'll know when, and strong, it can be strong, so you'll know when it's out. I have 2 examples of a drug screen analysis. This is going to be our urine cup. This is actually a 10-panel drug screen. So once you urinate here inside the cup, you're going to peel it back. It's going to show you everything. It's going to have 2 lines if it's negative and 1 line if it's positive. That means you still have something in your bloodstream. You still got medicine in there. Okay? And then we also have the one by saliva. This here is the same thing. You can see that there. Same results. Double line, 1 line. And this is a 6-panel, so it's only looking for 6-panel, 6 different drugs. And it's going to be some of the same drugs. You have your COC, which is your codeine, your MET, which is your meth. You have the THC, that's going to be your marijuana. And all you have to do, just take this here, and of course PCP. PCP is your street drug. You take it and you slob it on the inside of your mouth, and you saturate it with saliva. And once you get enough saliva on there, you're going to put it back on here inside, and you're going to close it until it turns pink. You're going to see all of that fill up, okay? And then it'll do the same thing, give you the same results as this one. The only difference is this is a 6-panel and this is a 10-panel. So it gives you, tests a little bit more drugs for this one. So doing excretion, if it's something still in your blood, it's something still in your system, it's going to be in your urine, but it's releasing itself, and it'll probably show up there, okay? And then there are a lot of different factors, you all, that go into drug action on how effective the drug will be. A lot of times people say, well, you know, it's because I'm young, or it's because I'm fat, or whatever the case might be. But believe it or not, they all play a part, okay? So the first is going to be our age. How old are we? Does that really matter? It does. So our metabolism and our excretion are slower in older adults. So if you're older, it's going to take longer for your medicine to break down and release itself. So therefore, you must pay close attention. And even for our children, because they have a lower threshold, and their response and they react more rapidly in unexpected ways sometimes, so you have to pay attention to them. So with older people, or older adults, should we say, the metabolism and the excretion is a little bit slow, so it takes the medicine longer to break down and release itself. So sometimes you're just like, well, I've been took this medicine a long time ago, I don't know why it's still in my system. Consider your age, okay? And weight. So far as weight, the bigger you are, the more dosage you want to give them. So the bigger the person, the greater the dosage should be. Many drugs are calculated based on the weight. Now, there are going to be some drugs that you should, when you have somebody that's obese, you should give them the amount of medicine or the dosage based upon what their weight or their ideal weight should be, not based on them being obese, because, of course, you're giving too much medicine then because they're overweight. I'm pretty sure you guys have seen the commercial on TV with the man and the woman. They were both taking a drug, and it was for weight loss. And then they want to say, well, why doesn't it work? Why is it working faster for you? Or why am I only lost 5 pounds, you lost 10, and we start taking around the same amount of time? Believe it or not, gender plays a big part. Gender, because women have hormones, and then we also, we tend to carry a little bit more weight than men. So it's going to play a difference in how our drug reacts to our body because of that. Excuse me. And then also if we're pregnant. So if a woman is pregnant, you want to be very, very careful about the type of drugs you take, because it's going to be what's best for you and your baby. So they always tell you a very, very good example of a common over-the-counter drug that you shouldn't take under any circumstances unless told by your physician while you're pregnant is ibuprofen and naproxen. Never, okay? So it's a good tip. Remember that. Then also you have something called psychological state. I know I've heard people say, I'm not sure about you, but I'm sure you have as well. Heard somebody say, it's just a mind thing. This stuff doesn't work. Believe it or not, it's called placebo effect. The placebo effect is just a psychological state. So if you think that the medicine is not going to work, then it's not going to work. So the definition of it says, and I quote, "It has been proven that the more positive the patient feels about the medication being taken, the more positive the physical response." So it's really a mental thing. If you feel like it's going to work, then it's going to work. If you feel like it's not going to work, then it's not going to work. It's called the placebo effect, okay? And then we also have something called drug interaction, you guys. This is really, really tricky. So let me tell you what drug interaction is. It's usually it's common for people who's taking multiple drugs. A lot of times when you go to the doctor, you're going to have someone ask you, okay, are you taking any other kind of medication? It's because if they have to put you on medication, they want to make sure what you're taking is not going to interact with something else and cause other effects. So we'll kind of get into that. It's 3 different effects. The first being synergism. Synergism is the action of 2 drugs that work together to help one. So it's going to be something that's going to work together to be more effective because it can't really stand alone, okay? So that's the first being. And then the second one is going to be potentiation. Potentiation is the action of 2 drugs working together, and then one of them is going to help and one is going to work and help simultaneously for another effect that it couldn't do it alone. So that's going to be synergism. And then, like I said, potentiation is the action of 2 drugs in which one prolongs or multiplies the effect of another drug. So it's going to either prolong it or it's going to multiply it. Excuse me again. And then you have antagonism. Antagonism is the action of 2 drugs in which one even decrease, cancel out. It just won't work at all. And one thing that's really interesting, you all, that a lot of people don't know, that an antibiotic will cancel out your birth control. Okay, so if you don't know, write that down. I'm sure a lot of people have gotten pregnant while taking medication and didn't know, and they felt, oh, I was on birth control. I don't know what happened. An antibiotic will cancel out your birth control. So that's going to be an example, a great example of antagonism, excuse me. That's going to be a great example of that. And like the reason being is because the birth control contains estrogen. And some antibiotics cause the enzymes in the liver to increase the breakdown of the estrogens. And therefore they can decrease the level of the estrogens in the body. And the effectiveness of the pill, it just don't work. It decreases the effectiveness of the pill. So if you know somebody that's on birth control that might be taking some medicine, they might want to see a physician, or else they might end up pregnant if they're sexually active. And then dosage. Dosage plays a big part of how our body reacts or how quickly it reacts to a particular drug. So we have our minimum dosage. Just a little bit. Minimum dosage is going to be the smallest amount of a drug that can produce a therapeutic effect. And then as our maximum dose, this is the largest amount of a drug that will produce a desired effect without producing symptoms of toxicity, okay? Then loading dose. The loading dose is when we're going to put initial high dosage, often a maximum dose, used to quickly elevate the level of the drug in the blood. So we want to hurry up and get it in the bloodstream, get it working. So we're going to put a loading dose. Okay, usually a maximum dose. And then our maintenance dose is just it just required to keep the level of the drug steady in the blood. So if you want to keep the blood at a steady level in the blood, it's called a maintenance dose. And then you have toxic dose, overdose. In other words, toxic dose is going to be an amount of a drug that will produce harmful side effects or symptoms of poisoning. So you can get sick. That means you have taken too much. It's toxic. lethal dose, a dose that can cause death. Don't go there. It's too much. Lethal death. Lethal dose that can cause death. And then therapeutic dose, and it's just a dose that is customarily given, adjusted according to variations from the norm. So like I said, it can even be based on your body weight. And like I mentioned earlier, you're going to have some people that are obese. So if they're obese, then we can't give them the amount of dosage according to their body weight, because it's going to be way too much. So we should give them the amount of dosage according to what their ideal body weight should be, okay? And then we have routes of administration. Woohoo! Routes of administration. How does the drug get in our body? The route of administration is probably the most significant factor in the speed of drug action. So based on how it gets there, it's going to determine how fast it does what it needs to do. Our 4 stages, how fast it breaks down, how fast it works, how fast it's distributed into whether it's the tissue, into the bodily fluids, wherever it needs to go. Your routes of administration is going to make a world of a difference. Okay, so first we have two main categories, and they kind of fall within a lot of different variables fall within those 2 different categories. We have external, or the GI tract. The GI tract is just like your digestive system, or intestines. You're going to have your intestines there. You're going to have your stomach area. It's your external, okay? A lot of times those drugs will refer to anything that's oral, that you have to take by mouth, by rectal, and even of sublingual. So here's an example of a sublingual, you all. This is a B12 drop. As you can see, it says sublingual right there at the top. A sublingual is taken by placing it underneath your tongue. So you just get enough of that there and place it underneath your tongue. So that's going to be what our sublingual is. And then a rectal, it's going to go up your rectum. And then we have parenteral routes. Parenteral routes are more so of your IVs, anything that contacts straight to your bloodstream. So more likely your IVs, and it doesn't really go into the GI tract. Okay, so this is going to be a little different. Parenteral means any route other than the GI. So remember that. That's the difference. Okay? Now, there are some non-injectable routes. Non-injectable routes, like we said, really our sublingual will go under there. Our non-injectable routes, because it goes under the tongue. Anything that goes on your skin, if it's a patch, that's going to go under your non-injectable routes, but it's still going to go in parenteral. That's still under that category, okay? Remember that. Now, there are some disadvantages and advantages of each route. As far as oral, whether it's a pill, anything that you're taking by mouth, it's the easiest way, but it takes longer. It takes longer to break down. It takes longer to get into your bloodstream. And that's fine, but it's easy. So some people rather take, go that route versus the IV, which is the parental route, the parental route. So our parental route is going to be, our IVs is going to get right to our bloodstream. It's going to be quick, but it requires a small dosage. So it moves slower, it moves quicker, but it's only a small dosage. Some people actually dilute the whatever it is that's going into the IV, because they want to slow down. Say, for instance, our Pitocin. Our Pitocin is usually given to reduce or hurry up and quicken labor. So a lot of times you will see the doctor, they'll come back in and out the room, stopping it going, because sometimes the labor can be moving too fast and we want to slow it down, and you see it's just barely dropping down the bag, barely dropping, but it's moving very quickly, and it's going to be based on the reaction that the baby is having to it, what the reaction that the mother is having to it, but that's a parental, okay? And that's an example of a drug that's barely dropping. It's going down very slowly, but the effect is very quick, okay? And then we have unexpected responses to drugs, okay? That can really cover anything. I know we talked about it a little bit on last week. Our adverse effects, things like that, our side effects. But this is going to be a little bit more different. So, say for instance, hypersensitivity. Hypersensitivity is going to be our immune response, okay? If we're allergic to a drug, that plays a big part. It plays a lot of different variables. So if something is has a mild effect with no immediate effect, whether it's a rash or whether it's hives, something like that. I know my sister, she gets hives when she's allergic to something. So sometimes it may take 3 or 4 days of drug therapy to actually go away. It's more likely to exist with patients who have other known allergies, okay? So a lot of times when you're going to the doctor's office, they're going to ask you, are you allergic? What other medications are you on? The other medications are for your drug interaction. And then we have our unexpected responses because we want to make sure you're not allergic to that. And make sure y'all remember that dizziness, headaches, pain, cough, all of those things can be unintended, okay? We don't want that to happen. Not at all. So then we have different things like tolerance. Now, a lot of people say this. They kind of say, oh, my system, it's gotten immune to the system, or the medicine doesn't work for me anymore. So what you're actually referring to is tolerance. Tolerance is going to be a decreased response to a drug reaction because you're used to getting it repeatedly. So what they're going to have to do is actually either increase your dosage, or just change it altogether and replace it because your body has gotten immune to it because it's taking it repeatedly over a course of time. Okay? So you guys read your chapter, review this video, go over it once, go over it twice, whatever it is that you have to do. If you need to call me to answer any questions that you might have, please do so. Make sure you're ready for next week. Bye-bye.